Hi, my name is Tara Childers, and I'm with the Frisco ISD Council of PTAs. And on behalf of Council, I would like to thank everyone who's here tonight and also welcome those who are at home watching on live stream. We want to thank the district and the Guidance and Counseling Department for putting on this great discussion about substance abuse and mental health. It's such an important topic for all the caregivers and parents in our community, and we appreciate you all being here tonight.
Thanks, Tara. My name is William Solari, and I'm a student support coordinator with Frisco ISD, and I'm going to introduce our panel. Actually, Dr. Gamber will give you that. The first panel member is Dr. Gamber. He's an emergency physician who serves as the EMS medical director for the Frisco Fire Department and the Public Health Authority for the City of Frisco. Dr. Gamber was selected as the 2015 EMS Medical Director of the Year by the Texas Department of State Health Services. He served as the Chief of Staff of Medical City Plano, a Level 1 trauma center, and Medical City Frisco. Dr. Gamber and his wife Lauren have 3 children who have attended and do attend Frisco schools. Next on the panel is Officer Morano. He's been a member of the Frisco Police Department for over 8 years. During his time, he was a SWAT operator for over 5 years and was a member of the deployment team. His current assignment is in investigations for the School Resource Officer Unit, which he's been a part of for almost 3 years now. In the middle is James Caldwell, who currently serves as the District Safe Schools Coordinator for Frisco ISD. He has worked for Frisco for 12 years and has been instrumental in implementing the OVEAS bullying prevention program in Frisco ISD. During his career, he served as a counselor, teacher, speaker, and consultant, and he works to create a culture in Frisco ISD of belonging and connectedness. He's a native of McKinney and a licensed professional counselor in the state of Texas, and holds a master's degree in counseling from UNT and an undergraduate degree in psychology from Texas State. Next to James is Shannon White. She graduated from the University of Texas at Austin with a degree in early childhood education. After her last drink on August 24, 2007, she left the teaching field and returned to school to become a licensed chemical dependency counselor. In 2011, the dream of having a treatment center became a reality with opening Grace to Change. Shannon has participated in multiple drug courts, has voluntarily taught moral recognition therapy classes inside the Collin County Jail since 2014, and has become an avid advocate of those suffering from the disease of addiction in Collin County. Grace to Change became a 503c3 in 2017 to better serve the indigent population of the county. And our last panel member is Judge Kimberly McCary. She's the judge of Denton County Court at Law Number 1, Denton County, Texas, sitting as a juvenile court. She has held the position since January 1st, 2011. Judge McCary is the chairman of the Denton County Juvenile Board. Prior to being elected, Judge McCary was in private practice, specializing in juvenile law, and served as the presiding judge of the town of Flower Mound Municipal Court. Judge McCary was a part of the inaugural class of attorneys who are board certified in juvenile law by the Texas Board of Legal Specialization, and she is a member of the Society of Legal Scholars of the College of the State Bar of Texas. Judge McCary speaks frequently on the issues related to juvenile law. So thank you all for being here, and I know you all are going to kind of present and talk about your specialties, and then we'll have a question and answer period at the end. So Dr. Gamber, you're first.
Thank you. It's good to be here with everybody. Thanks for those that are watching online as well. I'm here in a couple roles. My first is as a parent and husband. I've got 3 children who've come through Frisco schools and had an amazing experience with the school district. And so parents watching, I'm one of you. I serve as the EMS Medical Director and Local Health Authority for the City of Frisco. And that means I have the pleasure of working with all the police officers and firefighters in the City of Frisco. And we're here to care for you in your time of need and to help protect your kids, too. And so it's in that role where I work with over 200 medics in the city that will respond to 911 calls, some of which are fentanyl overdoses and other drug overdoses, too. So I look at every chart that comes through the fire department, particularly the ones involving drug use. And so that gives me kind of an overview of what goes on in our city. And this is an issue that's important to talk about. And then finally, as a practicing emergency physician, I see the patients that come in, either driven in or come in by ambulance or come in with police, and take care of those patients. So I'll speak a little bit about that too. The interesting thing about fentanyl from my perspective, I've been out of residency for about 20 years now, is it's a medicine that's been used for a long time. And when used appropriately, can be very helpful. Fentanyl is an opiate pain medication. It's a very strong pain medication. And many of you have probably received it after a surgery or in the emergency department. It's very common if you have a broken bone or you're having pain before, during, or after surgery to receive IV fentanyl. It's very effective at what it does, but what we're talking about today is not what's given in the hospital or the ambulance. What we're talking about today, when your child inhales or takes a pill, is 100 times stronger than anything we would give in the hospital. And our children don't have that frame of reference. And they don't have a tolerance for the strength of that medication. And that's why I can tell you, whether in my role as the medical director or an emergency physician, I've seen kids who probably have never taken drugs before die on their first dose because they just don't have the frame of reference for how strong this medication is. So I'm first here to speak about the seriousness of it, because as a fire department, when we're called to somebody who's unresponsive, there's a broad swath of things that can cause it. We're thinking about somebody's heart, we're thinking about somebody's brain, we're thinking about an overdose, and we're checking the scene for what might be going on. One of the things we'll administer to somebody who may be a narcotic overdose is a medication called Narcan, and we'll all talk about that medication today because it's now accessible to the community, and it's an important reversal agent to an opiate overdose. The school district carries it, our police officers carry it, our medics carry it. So we have it throughout the city available for first response. And it is a very safe reversal agent for an opiate overdose like fentanyl. Why does somebody die when they have a fentanyl overdose? So fentanyl is a respiratory depressant. When you take or overdose on fentanyl, it suppresses your breathing, suppresses your respiratory drive. So your heart doesn't stop because you take the medication. Your heart stops because you stop breathing. You take too much fentanyl, you take a potent pill. It takes one pill to kill your child, and then your child will slowly stop breathing, and then once they stop breathing, their oxygen levels drop, and shortly thereafter, their heart stops. And that's how that process works. The goal of Narcan is to start somebody breathing again by reversing that opiate overdose. Narcan cannot restart somebody's heart. We have to give Narcan before the person dies, and then Narcan will increase their respiratory drive again. And as their oxygen levels rise, they'll improve. And it's quite dramatic. I think in all of our respective roles, I've seen people that were blue and near death receive Narcan and start to perk up quite rapidly. You cannot hurt somebody with Narcan, okay? And I think that's another important thing to understand. If you're thinking that somebody might be an opiate overdose and you have access to nasal Narcan, please give Narcan to that person. You cannot harm them. You can only reverse the opiate overdose. If they wake up from it, then it was an opiate overdose. If they don't wake up, it's something else potentially, and we'll still check out and treat the other things it could be. But one of the main things I can do today is endorse the community access to Narcan. Again, as a parent, I have Narcan at my house. carried in the car. I'd like to think that my kids and their friends, aren't doing that. But at the same time, you never know who they might be driving, and they might need access to it as well. So it's important to have around in all the environments that our children are in, whether it's your child or somebody else's child, just have it around. Because they're the ones that are at the parties. They're the ones picking up somebody who might need a ride home, and it's potentially helpful there. So I could go on for a while, but let's pass around and talk about our roles, and then maybe we'll have some questions and go back and forth too.
Good evening. My name is Officer Brent with the Frisco Police Department. Thank y'all for having me here tonight. I wanted to talk about the police side of fentanyl and what we're seeing in our city and in the area, and just kind of put some information out there to kind of inform people what it is that we're dealing with out there. Up on top, my information's up there. Again, I'm a school resource officer right now. I provided my email, for my work email and my FISD email if anybody has any questions, concerns, or would like access to some material. I'll have some material in here for you guys, some QR codes that you guys can scan so you guys can have as reference. And if you guys have any additional questions, you guys can always reach out to me. I'm available to anybody that has questions regarding this stuff. All right, a little bit about me. I'm a school resource officer. I'm currently at the Hunt Middle School, and I do assist at the high schools and really anywhere that an SRO needs assistance or in the district. That's how I kind of ended up here, and I absolutely don't mind. I like to kind of meet with the public and help or answer any questions. So what we're seeing out there is we're seeing different pills that aren't what they're supposed to be. And what we have up here on these slides are M30 pills. Those are oxycodone. Those are the most popular pills that are being used right now. And what's happening is that these pills are oxycodone, but we have these drug dealers that essentially can buy fentanyl pretty cheaply and put an amount of whatever amount they feel like they need to inside these pills and repress them. So what's tough about this is that more often than not, like I'm looking at these pills and I can't even spot the fake myself. I will say that in our experience, we are running into pills, we're testing them, and a lot of our pills are coming back with traces of fentanyl. And it's stuff that you wouldn't even think would have fentanyl in it, but fentanyl is being pretty much added to everything because they want that addiction factor. It's not for an extra kick or anything other than they want the substance to be even more addictive and make people come back and have more, all right? So fentanyl is a synthetic opioid, and it is definitely being cut into a bunch of different stuff. We have Oxy, Xanax bars, even Adderall is being put in Adderall, which is odd because one's a stimulant and the other one's an opioid depressant, and so you would think that doesn't make sense. They kind of counter each other. Again, it's not for the depressant part of fentanyl, it's for the addictive part of it. That's what makes it scary. So up here, guys, provided y'all with, it's 2024. Social media, these kids they find ways to communicate. Long are the days where you go to the usual corner to find your drug dealer to talk and get whatever you want. We're seeing Snapchat, Messenger, different apps that these individuals are using to promote their products. And what we're seeing is that they have like a little code, like nobody goes on and says that, hey, I'm looking to score some fentanyl, looking to score some Oxy. They're using emojis to kind of communicate and to kind of not criminalize themselves. But we figured out what they're doing. And all this is reported through the DEA, and it's available to everybody. So there's different ways that fentanyl is being used. In my experience, I've seen every single one of these, and I've seen every single one of these in an overdose as well. And so People are on the far left. You see tin foil that's all burnt. They're burning it up and inhaling the burnt fumes. It's being crushed and snorted, and it's just being taken in the pill manner. Fentanyl is not just added to these drugs. We're seeing it being added to meth, to other things that are already highly addictive, and all they're trying to do is just make it even more addictive. Just kind of build the client base, get those returning customers. So, what some of the effects that fentanyl is having on an individual? We kind of covered a little bit of that already, but they're the super relaxed, the euphoria, the pain relief, the sedation. It is an opioid, so you're going to get all those same symptoms. But then you can kind of, again, your drug dealer isn't a chemist. They're just kind of winging it and putting whatever they feel like in some of these pills, and they're sitting there repressing these pills. So they're creating these pills, and so it's always an unknown quantity. What we're finding is that all the pills that we're finding, when we test them, most of them have a lethal dose of fentanyl inside all of them. So some of the overdose effects that I've seen individuals where they're laying down, they're hard as a board, their lips are blue and gray, they have those tiny pupils, and they're barely breathing. Like I didn't think they were around, and every now and then you'll see like a weak breath of air that's almost forced. And it's been phenomenal seeing these same individuals being brought back with Narcan. I've seen it firsthand, and this stuff works. People that are on death's door knocking, they come right back, and they're kind of surprised, like, "Whoa, what are y'all doing in here?" It's like, "Dude, we just saved your life." So it is highly effective. It doesn't mean that it's over at that moment. We still need to get these individuals to the hospital. We need to put them in an IV, and we need the continuous Narcan into their bloodstream to stop the opioid from continuing its effects on the body, because the body will use up the Narcan. So we need to keep providing Narcan until all that opioid is out of their bodies, essentially. And I'm sure Dr. Gamper can talk about that. So this graph right here, I have data up to 2021, but we're seeing a massive rise in deaths, overdoses of fentanyl and opioids. It really just kind of took off in 2015, but 2021 we had over 70,000 reported reports of fentanyl overdoses. And so we kind of talked about the how lethal fentanyl is, and it could take as little as 2 milligrams, little less than what's on that tip of that pencil, to cause an overdose effect. And like we're saying earlier, we're seeing it mixed up in everything. I read a story about a young juvenile female tried marijuana for the first time. This is in a different state. And she tried marijuana for the first time, overdosed, and passed away, and came to find out the marijuana was laced with fentanyl. And so it's all out there. And again, all they're trying to do, marijuana overall isn't supposed to be addictive, or they say it's not supposed to be addictive, but I mean, they're trying to make it addictive. They're trying to get people to come back. And so it's being added to a lot of stuff, and that's what concerns us the most, and that's why we try to just communicate with parents about talking to our kids, being transparent with our kids. I meet with kids all the time at my school. Parents will reach out to me about, especially right now because it's Red Ribbon Week, so we're having a lot of advisory lessons about this stuff, and they asked me to talk to the kids, and I've shown this presentation before, or parts of this before, and really like seeing the kids like open their eyes, like, oh man, like this is serious. And I think if we can reach those kids that way, that'd be great. And I'm gonna show y'all some resources that we can kind of do that together. Some of the trends that we're seeing is that rainbow fentanyl, and if you look at it, the scary part of that is that looks like candy to me. Like that looks like a child would just stick their hand in that, and grab a bunch of it, put it in their mouth, and that's kind of terrifying because each one of those could potentially overdose a grown adult, and so we're seeing that fentanyl is a lot more addictive than heroin, than all these other drugs. So I thought this was very interesting, guys. 2022, they seized over 13,000 pounds of fentanyl, and that all the fentanyl that they seized of that year was enough to essentially create a lethal dose of fentanyl for every single U.S. citizen in the U.S. Like there's more fentanyl. Like it's ridiculous. Like it's coming in from China, from other places. It's not necessarily manufactured here, at least the illicit fentanyl, because we use fentanyl in the hospitals, but this fentanyl is coming from other places. But just in 2021, and all these numbers go up, unfortunately. These are 2021 statistics, and that's just what we seized. That's not all of it that's coming in, and so. And so here we see how a lot of these drug dealers and people that are taking fentanyl and putting it into their products, they look at it as, how do I make returning customers? How much are they spending on this fentanyl, this street fentanyl, adding it to their products and increasing their profits? And so at the end of the day, they're looking at just making money off people, and unfortunately it's costing lives, and lives of people that or maybe trying something for the very first time, or they think that they're trying something and you ran into fentanyl. So, like we were talking about earlier, we have a Narcan available to all of us. This is something that is in our schools. Our nurses have them. SROs have them. Every single officer has them. I carry it on my person. I have some in my office. And when we respond to overdoses, I always, if I'm responding to an overdose, I don't care what kind of overdose it is. I'm going to take it with me, because we're taking it there not for us but for them. And so that's a kind of a misconception. Like, we are trained to use it to try to save that life. We're not holding it on to it for us. We want to try to help people. We can always get more. We have more officers coming. Our medics are coming. Like, we just got to get it in there and get it into this person. And even if it's not fentanyl, like it could have been fentanyl. We could have saved them. We got the ball rolling with something for them. So here I have 2 QR codes if you all would like to scan them. The first one on the left is a really good website from the DEA. There's a lot of reference material in it for parents and for children and for students and educators. There's videos, stories of parents, mothers talking about their children and just kind of sharing what their experiences are. The program's called One Pill Can Kill. And I highly recommend everybody to kind of go on this website. It talks about how the DEA partners even with esports. They'll sponsor esport competitions and stuff just to kind of get drug awareness out there. Like they're trying to reach our kids in a positive manner in things that they are interested in nowadays. There's different programs on here, just different methods. There's suggestions on how to talk to our kids about this, how to bring it up, what to bring up, and great resource material for us as parents. And the other one is the little drug chart thing. If y'all ever go through your kids' phones and you start seeing some of these emojis, those are little red flags, and y'all guys can contact your school resource officer. I have my info on here as well, and you guys can always reach out to me as well. I can help out with that. And so here's my info again, if anybody missed it. I'll go back to the other slide in a second.
Thank you. I'm going to kind of give a different perspective, because what I'm looking at is more on, instead of an intervention side, is more on the prevention side, and just share a few things with you about how we not only do our drug prevention programs, but just prevention efforts in general. Now, it's kind of odd because I can't see these slides behind me. So I'm just going to have to put myself in a trance, I think, to figure out what's going on here. It might be easier if I come over there, but let me see. I have a monitor here. Don't think I'm going to call people. It would be kind of odd, wouldn't it? We'll just play like we're up here together. Thank you. It's a good thing I have that. But one thing we focus a lot on is having a positive school climate, because when you have a positive school climate, kids feel connected. They're less likely to bully, get bullied, use drugs, deal with issues of feelings of suicidality. They just tend to gravitate toward positive things, and we try to provide as many positive things as we can in the schools for them. This is not going to work with this. Let me just come over there. Everybody play like I'm already over there. All right, thank you. Oh, that's a lot better. You know, this is an activity we do. We have, like the officer was saying a minute ago, we have advisory lessons, and that's one of the main ways that we get information about our prevention efforts out to the students. We also have kind of activities kind of like that for adults we call staff discussion lessons. So the adults take part in these as well. An example would be how we kick off a lesson. I was at a principal meeting last spring, and they had this one. And think back on your days in school where you experienced a positive school climate. Panelists, I'm going to put you on the spot here. Can any of you think of a positive school environment that you participated in? We have another microphone. Oh, there we go. Well, how about you, sir?
I can think of a couple. I mean,
Yeah.
I loved my history class in high school, and we'd all read and come in, and we were just encouraged to talk about everything we learned in a very open way in there. And then I think about the teachers that I grew the closest with, and the students I grew the closest with were sometimes when we went out and did activities together. And I think back to like a study abroad trip I had with a lot of other students and a teacher that all became good friends. So those are the things that kind of fostered a love of learning for me.
Yeah. I think, did you want to share something? You'll probably need a microphone.
It's still sort of embarrassing even at this age. But even at this age, I can recall being bullied pretty much relentlessly, and it was the kindness of a teacher that saw it and reached out to me that to this day I will not forget.
Yeah, that's great. Did you want to share something?
I can remember in third grade, Miss McChesney would let us work, and I got to work ahead in the math book, and I felt like I was so smart. And whenever we did stuff, she gave us marathon candy bars, and you got like one per week, and if you were the one with the marathon candy bar, you got to eat it in front of everybody and totally show off. So
yeah, I never had to worry about being ahead in math. That's probably why I'm a counselor. Yeah. Yeah. So what we typically do is people would share with each other. Sometimes we'll ask students to go find another student that they either don't know or they don't talk to, and try to do what we can to just make everybody feel included and feel like they're a part of the group. Some benefits of having a positive school climate: enhances ability to learn really anything, sets the tone for physical environment, really just to where kids feel safe, improves academic success, creates a welcoming environment, helps students feel cared for, capable, and connected. That's our motto in the counseling department, because we know if you're missing one of those, you're going to be suffering in some way. And so we try to figure out what the need is there and meet that need. Here's an example. This is from an 11th grade survey we have called the Safe Schools Survey. And if you look at the top left quadrant there, all A's, top right, A's and B's, bottom left, B's and C's, and to the right there at the bottom, mostly C's and F's. The question is, I feel like I'm part of my school, I belong. You can see it, the kids who make mostly A's, only 5% said that they don't feel like they're a part of the school at all. They don't feel like they belong. But if you go down to the right at the bottom, 43% of those kids say they don't belong. And we know that belonging and connectedness buffers trauma. And so when you're around people that you know, and when you grow up in a town, I grew up in McKinney when it was really small, and you know everybody, and you kind of rally around each other. And so a lot of these kids move in from not only other parts of the state, but other countries and other parts of the world. And so they don't have that. So we try to create an atmosphere of belonging. And one thing that was kind of mentioned earlier, or I think you saw this slide, the whole child model. That's just what we call our prevention efforts in general. And it recognizes a student's academic success. It's really just a holistic look. It's affected by multiple factors, including mental, emotional, physical, social, and environmental, and spiritual health. It's an effort to transition from seeing things in a narrow way to seeing things in a broad way, that there are multiple factors affecting our health. Believe optimal learning takes place when students are healthy, safe, engaged, supported, and challenged. And our advisory lessons and really everything we do is to try to make that happen. Here's kind of a traditional look as far as holistic health goes. You can see at the top, if all we focus on is genetic and medical factors, we're going to miss a lot. And typically when students are using drugs, and a lot of times they're doing so to kill pain. We know that our kids go through a lot of serious things, and some that might not seem so serious to us are very serious to them. And we have to remember that they have needs that we don't have, and we have to try to look in and see things from their point of view. The one thing they don't like to be is judged, and so we want to try to just do what we can to make them feel accepted and get them to the people. The teachers are trained to recognize signs of depression and feelings of suicidality and things that a student might say, and their goal is to get them to the counselor's office to get them the help they need. So what does this all entail? As far as like the whole child program, it covers all those things. I'm not going to read those, but just take a look and kind of look down through there. And there's a lot that's going on. So through advisory lessons and just through trainings throughout the year, those are the things that we cover. Student voice programs, we have a program called Student Ambassadors that we're proud of because it became a statewide thing. They kind of copied a little bit, but we were glad to share everything with them, and they actually came up here to the district to check it out. People from the Texas Safety Center and San Marcos. So that's an exciting thing going on, and that's in the high schools. And then at every campus in the district, we have a whole child committee, and the whole child committee oversees all these things that you just saw on the last slide, and it's led by an assistant principal on the campus. And then it's divided into two subcommittees, health and wellness and safe schools. And health and wellness is kind of like what it sounds like it might be. Safe schools is kind of misleading. It's really all of our prevention efforts like bullying prevention, suicide prevention, drug, that type thing. And it's overseen by a counselor. The health and wellness one is overseen by just some fitness guru on the campus. And when we talk about some advisory lessons, a lot of the things that we address are state mandated. And we call them class meetings. That's where they do their advisory. And they do them usually once or twice a month at the secondary level, and every day or every week at the elementary level. So we go over a reporting process, how to report. We have an anonymous reporting system called Stop It. We had over 2,000 reports of concerns for student health last year. Most of the time, those are not self-referrals, but friends who are concerned about other friends. And then bullying, suicide, a lot of this has already been, these trainings have already happened. Healthy relationships, digital citizenship, substance use, and campus choice just means whatever they might be covering that's specific to their campus. All right, hopefully, I know that's kind of quick, but hopefully they give you an idea of what we're talking about with prevention on our campuses.
So I'm not going to use most of my presentation because the smart people ahead of me have already used it. You heard that I was an elementary school teacher. So one of the things that's important to me is that we get kids to understand exactly how dangerous these things are. So I took a paper plate. Pink is fentanyl, green is whatever else they mix it with, baking soda, meth, whatever other drug. And you can see over here, I mixed it up a little bit, and you can actually still see when you scoop it out. So what they're doing is they mix the drugs, like in a witch's cauldron. That's the example I gave the other day. You just mix it up in something big, and then they scoop it out and put it in a press to make it look like a pill. So you can see on my illustration over here, there is no way that you know this pill has fentanyl, this pill does not have fentanyl. And we use the analogy of a chocolate chip cookie. So some chocolate chip cookies you make, you can see if they're good and homemade, they put a lot of chocolate chips in it. You can tell right where you bite. And if you were to test that, there's actually test strips that are illegal in Texas, but in other places, you can actually test a portion of the pill to see if it has fentanyl. But if you test a portion of the pill, that doesn't mean you're testing all the pill. So you can see just how difficult it is and how easy it is to die because you don't know what you're getting. So we showed the pills. These are the things that your kids are looking at home. All of these have THC in them. One of the things that's the most concerning right now is Officer Moreno talked about the carts. So marijuana carts are a high level of THC. They look like a vapor cigarette, and they are being laced with fentanyl. Now, here's the issue with that. We had a student in McKinney who had a cart and got caught in school with the cart. So it had THC in it. It was a felony because of the THC, and it was on school grounds. Now, there's new laws in Texas that say if you give someone fentanyl and they die, you are charged with murder. And so if this girl had said to her friend, hey, you want to hit off my vape in the bathroom, which happens all the time, and the person had dropped dead, she would have been charged with murder, and she had no idea that there was fentanyl in her vape. So going to jail actually probably saved her life. This is the number of increase percentage-wise. As I was sitting here, I got a thing from the Dallas Morning News that says fentanyl overdoses are down 18% in Texas. Now, I'm what they call a reality therapist. So logic says, that's super exciting, that's so great. What's actually happening is overdoses are on the rise, and people are being revived with Narcan. So yes, we're celebrating the fact that deaths are going down, but the number of people overdosing and actually putting themselves at risk of dying is increasing. So I illustrated these three guys. Preston up here on the far left died of a fentanyl overdose. He bought a Percocet. He's a Frisco kiddo. He was 24 years old. He bought 3 pills. He took 1, and he died sitting in his recliner in his bedroom with his Whataburger hamburger in his hand. Jason over here, he was dumped at the hospital by his ride or die friends, and he was dead basically when he got to the hospital. He was on life support for 9 days, and we tried to donate his organs and we couldn't. So he passed away. Jesus down here in the bottom, he's a Frisco student. He was in my treatment center on a Tuesday night. He was dead Wednesday morning from a fentanyl overdose. So we can't scare people into not doing drugs. My job is to illustrate and educate people on the dangers of it, because I choose to believe if we equip our children with knowledge about drugs, it gives them the ability to say no. If you are a parent and you are wondering how you can help your child, start drug testing them. I know people say that takes away their innocence. They can't be a kid. What if they're not using it? They're going to think we don't trust them. So what? Give them a drug test and say, this is your excuse. So when your friends say, hey, you want to try this? You get to say, no, my parents drug test me. It's not worth it. I don't want to get caught. Because I have people call me all the time and they say, my kid's doing drugs. I think they're doing drugs. What should I do? Well, bring them up here. I'll do a drug test on them. For $30, I'll do a drug test on them. Well, no, I don't really want them to think I don't trust you. Okay, well then, when they have to go to the hospital and this escalates to something worse, remind yourself that I said a simple drug test gives you the information that you need. Narcan is available. I have it in my office in McKinney, and it's free. So if you need Narcan, you want Narcan, all you got to do is come by our office and pick it up. We give it out to whoever wants it. So, because as Dr. Gamber said, our job is to get it in everyone's hands. If I had my druthers, every school teacher, especially every high school teacher, would have it in their classroom. Because I would rather you have it and never use it than not have it. So I put some numbers up on the screen for you. I want everybody to know that in Collin County, if you have no health insurance and you qualify as indigent, then there is medical insurance for you to receive mental health and substance abuse treatment at no cost. We provide adult outpatient treatment, and we are the only adolescent provider that takes this form of payment in all of Collin County. So, but there is no excuse. People say all the time, treatment is too expensive, I can't afford it. There is no excuse. And if you need treatment and none of this works, get to me and I'll figure out how to get you the help that you need, even if I have to scholarship you. We cannot lose any more children to this. And we cannot scare our way out of it. We cannot arrest our way out of this. We cannot stop the border enough to get our way out of it. The only way we can do it is to educate ourselves and the people that we love.
Thank you. Well, thank you all so much for being here. My name is Kimberly McCary. I'm the judge of the Denton County Juvenile Court. And I serve 2 populations of people that are facing problems with the law. I serve people of any age, so it could be a man or a woman 40, 50 years old, if they're alleged to have committed a felony when they were a juvenile. And I also serve a population of kids as young as 10. Can you even process that? As young as 10, all the way up until 17, who have been accused of violating the law. So when you turn 17 in Texas, you're treated as an adult for criminal law purposes. My role in being here today, my part is supposed to enlighten the parents on the legal consequences of a young person getting in trouble in court. I will tell you that's not where my heart is. My heart is to do and say everything I can to communities so I don't have a job anymore. What I mean by that is I wish there were not a juvenile court, because every single one of these kids matters. The people that I see in my court look like the people that are here today. They look like the kids that I saw in the, I think, 27.3 school zones I drove through to get here. But those are the kids that we're seeing in juvenile court, and every single one of them matters. And I wish I didn't have to meet them in the capacity that I do meet them. I do tell them often that I know there's going to be a day that they're sitting in front of a bunch of strangers and somebody's going to be talking about all the magnificent things that they did in their lives. But when it comes to the juvenile court setting, sadly, we're talking about the quote-unquote bad things. I do not believe in bad kids. I've been doing this for a long time. My gray hair tells that story. I cannot tell you of a bad kid that I've met. I do believe in bad decisions. And I think it's important as professionals that we learn what's behind the bad decisions. So I very much want to be informed, whether it be trauma-informed or just knowing what's going on in that young person's life that got them into juvenile court. And by virtue of you being here today, I think you want to know what's going on in their lives to keep them out of juvenile court and, quite frankly, to keep them alive. It is that dire. I cannot tell you all how many cases I have that get non-suited, that get dismissed, because I can't even envision this. The kid is now dead. There's no juvenile case pending because the kid is now dead. So if there's anything that all of us can do to make sure that doesn't happen to your families, it will have been worth all of our efforts. And so when we talk about the juvenile cases that I see in my court, they run the gamut. They're everything from assaults. If y'all watch the news, we have a lot of school threat cases right now. We have assault public servants right now. We have so many assault family violence. And we have a lot of property crimes. We have a lot of crimes done out of impulse and lowered inhibitions. And if I don't believe in bad kids, which I don't, if I believe in bad decisions, which I do, what is driving these bad decisions? What is driving so many assaults within the family? I will venture to say that any of you all listening have probably had a fight with your youngster over giving up their phone. What is it on their phone exactly that they don't want you to see? I was going to bring up that emoji business. I'm going to venture to say they don't want you to see what's on there. What, you have a bad kid? You have a bad kid? No, you don't have a bad kid. You have a kid faced with the reality of the things you just saw on the screen. If you see those emojis on there, if they're not wanting to give up their phone, unless you have the conversation, it's going to snowball. I think it all starts with conversations. At the dinner table, faith-based on the way to your service, we talked about you drug test your child or not because what you don't want to offend them. It all starts at home. The property crimes that we're seeing, breaking into cars and breaking into houses, I've said this before, they're not trying to get my Barry Manilow CD, right? Right? They're breaking into cars and homes to get things that they can steal or sell. Why? So they can buy drugs. We've had so many vehicular homicide cases, negligent homicide or vehicular type crimes. They're getting in accidents being under the influence. And so I think that drug use is a big driver of all of the cases that I'm seeing. And how can I posit this to you? How can I say this to you? Well, every child in my court that pleads true or is found true, I try to talk to him or her. The first thing is I try to say something positive about every child that comes to my court. I try to tell them they're not defined by the thing that brought them into my court. I do try to start there. But I also want to know what's behind the behavior. I'm telling you these things not because I think that they're true, and they're coming out of the mouths of these kids. The kids are telling me that these things are true. These kids will tell me that contrary to what other states are trying to pitch to us, marijuana is harmful. These kids will tell you marijuana makes them lazy. That's not supposed to be true, right? All these websites in other states don't tell us that. The kids will tell you that marijuana is addictive. That's not supposed to be true. They will tell you that it is a gateway. Well, we all heard that that's not true. They will tell you that they absolutely know it's laced and they will roll the dice. I wish y'all could come to court with me when you hear the kids say that. I know it could be laced. I know I could die. and they will still do it. Why? Because it's addictive. It's hard to understand this fentanyl addiction because we've had kids that have been revived I don't know how many times and will still go back to it. When I tell you it starts small, this is not the drugs of, say, my parents' era. This is not like the green leafy, single-digit THC content drugs. This is high-content THC. That in itself is a problem medically and mental health-wise, I believe, and I'll touch on that in a minute. But these are not the drugs that you all face. So when you think your kids can withstand the temptations maybe that you withstood, it's a different ballgame out there. A young girl told me that she first did try to buy this green leafy at the park from a drug dealer that she met on Snapchat. An adult man gives it to her. She likes it. She goes back. You don't get a whole lot of money for selling the green leafy anymore, right? So she goes back. He ups the ante. She goes back again. He ups the ante. Eventually, he laces it with fentanyl. She gets where she had to be revived. She goes back to him specifically looking for that. After a near-death experience. Do I still to this day think she fits in that bad category of kids? No, I don't think she's a bad person. But that's how addictive these things are. The other things on your phone, in addition to these emojis, my kids have Snapchatted the delivery of drugs, right? And guns, by the way. Their little icon for that, right now it's Poles, P-O-L-E, but I don't know what they're going to use next. They always try to outsmart us with, what are you hearing? Stick, pole. So these kind of buzzwords that you're seeing for the drugs, that is also true for weapons. I've had kids literally the Uber driver comes over with the drugs. And so know what apps are on your kids' phones. Know that they can absolutely be hidden on the phone. Know that it is your phone. How many of the phones are actually bought and paid for by your kids? It's your phone. Kids don't own property in Texas anyway, but the other angle that you may not be seeing, that phone is in your name. Have you ever done a search warrant? It's happened to us for porn cases. The police do the search warrant. The phone comes back to dad. We've had cases where dads got arrested for the porn on the phone, and they have to cough it up and say, oh, that's really my kid's porn. I mean, who wants to be in that position? So that's the other thing. Your kid's phone that they're doing these drug transactions are actually your phone. And I don't know about y'all, what jobs you all have. If I get arrested for porn or drugs, I'm probably going to lose my job before I can prove my innocence, right? I don't know if that would happen to you all, but that's...
Kids can't own property in Texas. So a phone, any of that, kids can't own property in Texas. And a kid is 17 and under or 18?
18 and under for property. So it's the parent's phone, right? And those harmless nudes. I'm going off topic, but do y'all know what nudes are? These girls are so bold. When I was growing up, nude was the color pantyhose, and I would be right? Nobody knows what pantyhose are either, so I'll have to define that. If any of the kids are listening, pantyhose or these things. But now the girls are very bold, and they do take those pictures of topless or otherwise, but that could be child porn. And that's another thing that your kids, why they don't want you to see their phones, because that's on there. But remember, the phone's probably in dad's name. And if that's your daughter with her picture on your phone without clothes on, that's a problem, right? So that's another reason to be talking to your kids. I definitely did get off topic there, but really what we're talking to you all about today is, of course, the drugs and the mental illness. And to me, it's very circular. We have so many kids that are self-medicating, and that may be the excuse that they're giving you. You know, they have a lot of anxiety, so they're going to do some marijuana. I'm going to just reiterate again, today's marijuana is not the marijuana of the 60s, and the proof is that the high THC content, 90% THC, that is actually anxiety producing. It's the opposite effect. So it's not harmless if your kids are saying, hey, I've got a lot of anxiety, I've got a lot of school pressures. the lacing aside, it's not ultimately going to help because it is actually anxiety producing. So I do think that that is a circular problem, that we have kids that are self-medicating, and then what they're doing to help themselves is actually making it worse. Again, it all comes back to conversations with your kids. The signs that you can look for, the laziness, the lack of interest in friends and activities, the withdrawal from you all. If y'all are seeing the kids hold up in their rooms, just totally addicted to their phones, I would challenge you all as adults, because I see it when I go to restaurants, I see it before church service starts, the adults are on their phone. So put that thing down and start the conversations with your kids. There's websites that are called conversation starters. I don't know if you've seen those, but they are really helpful, because how do you even start the conversation? Well, little Joey, have you taken any THC this week? How do you start talking about that? You know, it may be, how are you feeling, and things like that. This is what I'm seeing, let's talk about it, versus a full frontal confrontation when y'all get home and let me see that phone. That may not exactly be the way to go that. But if you start the conversation, they know you care. When I talk to my kids in court, a lot of times I'll ask them, will you pass a drug test today? And they'll say no. And like, mom or dad is, I can't believe you told her that. Why did you tell her that? And I've had kids say, well, she asked, you didn't. I promise you they want to talk to you about these struggles that they're having. You're their best prevention from a life of addiction, truly. As far as saying you're going to drug test your kids, I think you should. I don't think that that's a lack of trust. I think that's just reality. The things that you do for your kids, I don't know if you believe in immunization, if you believe in sending them to school, if you believe in taking them to the doctor. I just think in this day and age, it's just another level of things that parents have to do. I think actually the kids will see it as, and the reason I say that is peer pressure is huge. Do you know that peer pressure, when the kids do what their friends want them to do, it actually triggers that dopamine reaction in their brains? When they do what their friends tell them to do, it makes them feel good. And so I think if they had an out, I really do think if they had an out, I give it to them all the time in court, and I tell them that. I tell them, you tell your friends that that judge said you had to be drug tested, and I will detain a child for failed drug tests. It's not that I ever want to punish a mental illness. No, I do not. It's not that I want to punish a true addiction. I do not. But I absolutely will not look away from a violation of the law and a violation of your court rules. There has to be consequences in life. It's not that I don't care about the addiction piece. I definitely do. But just so you know what my position is in Denton County, I will detain a child for a dirty UA. So as a parent, I really think you're giving them an out. You're telling them, hey, if your friends offer this to you, just blame it on me. If I come up negative or positive on a drug test, my dad's going to take my cell phone, going to take my car keys. If you put your kids behind the wheel, I don't know if any of your kids that are listening or here today drive. If you allow them to drive the motor vehicle, which again I venture to say whose name is it in, and they're driving under the influence, I would think about your liability. And for that reason alone, would you not want to make sure that they're sober? And so I feel like that's a protective factor and a way for them to tell their friends no if you'll tell them that you will drug test them. And you have to follow through. Kids have great bullcrap meters. If you're talking bullcrap to them, they're gonna smell it out really quick. And I also think kids have an awesome sense of justice. And so if they're passing their drug tests, likewise, why are you not affirming that? Affirm all of the positive things that in their lives that they do. I think that's equally as important. Because I'm supposed to be here talking about what happens in court, not what happens in my heart, I will tell you in court, if a child gets any of these offenses that we're talking about and he or she comes to my court, I literally love my kids. I miss them when I'm not in court. I covet them when another judge has to hear a case for any particular reason. It does not mean I will not hold them accountable. And that means that for many of these offenses, they could spend time in juvenile detention. I'm probably way over my time. Maybe I should stop here, or...
You're good.
Okay, all right. Well, let me tell you about juvenile detention. It is, in truth, a cinder block building, a cinder block room, a metal bed screwed to the floor that your child will spend the night in until he or she sees the judge on the next business day. I hope you heard that. So I love Thanksgiving. I love everything about that weekend, except I go home and my kids stay there. Every kid that comes in Wednesday does not see me until Monday. If they have an adult co-offender, that adult co-offender has seen the judge and bonded out. Your child will sit in detention till that Monday. I don't know how you deal with that. What I can tell you is I have exacting, demanding expectations of my people that work in the juvenile detention facility, and they're awesome. That doesn't mean I don't think it's got to be just unbelievably difficult for you all. Don't think that they can just run around there in their street clothes. They will come in, they will be removed of their clothing, they will be searched, they will be placed in a jail jumpsuit and whatever clean pair of underpants just got out of the washing machine. We're not going to let them have their own clothes, their own underpants, their own shoes. It is, in all respects, a jail for young people. When they go into their room at night, that cell door locks behind them. When they come to see me in court, again, I don't assess bond. I either release or detain. The period of juvenile detention is 10 business days before they have a right to see a judge again. I'll think about those kids every day that they spend back in detention. I'm thinking about my kids that are there now, but that doesn't mean I won't detain them for 10 business days until I can feel secure that this is a basis for detention. They're a danger to others, or you need to hear this, a basis for detention is they're a danger to themselves. And to me, the things that you're seeing there makes them a danger to themselves. In addition to being in detention, you all have to pony up and hire an attorney. If you don't qualify for court-appointed attorney, that's an expensive process. There's a lot of collateral consequences to juvenile cases, driver's license suspension. I'm seeing all of these applications in different areas of their lives, jobs, scholarships, military. Do you have a juvenile case on your record? If certain offenses happen in school and happen under my jurisdiction, I think the officer can tell you that I will have the child go to the Denton County Juvenile Justice Alternative Education Program. They're removed from their regular school and all of their regular activities. And it took me a good hour to get here. So there is a Denton County part of Frisco, so every day you bring your child to school and her home. So there's a lot of legal consequences. That's what I'm supposed to be here for, and so I'll entertain later on any questions you might have about that. Thank you for your attention, and thank you for being here, and your love for your kids is evident.
Okay, thank you, panel. We do have some questions, and if you're in the audience and you have questions, just Ms. Williams will come by and pick up those questions for you. The first question is, what are the early indicators for a child experiencing mental health issues and possibly considering substance misuse? So whoever wants to answer at any point.
I think it's so tricky because one of the things that it happens with drug use is basically someone starts using drugs, alcohol, marijuana, and they basically look bipolar. They're up, they're down, they're up, they're down. So I think for me, first and foremost, you need to rule out that there's any substance use issue by a drug test or whatever. I also think parents know their kids. So if they're retreating to their room, if they're depressed, if they're lethargic, there's a lot of those things. I think being an ex-educator myself, I think interacting with their teachers and understanding what's happening at the school level. We've got a lot of kids that are being diagnosed with ADD. I myself have ADD. You might have noticed my leg the whole time. There's medication for that now, and some of it is non-addictive. And so I really, really encourage people to get a good psychological evaluation for their kid. If nothing's wrong, no harm, no foul. But if something is wrong, the earlier that you can intervene and start watching for those symptoms, the better off for everybody.
Yeah, I just see with the kids that I work with, just parents will mention that they just suddenly are acting differently. And a lot of times they get angry over things that aren't like we would think a very big deal. They have a really hard time waiting on things. The delaying gratification is very difficult for any kid nowadays, and adults. And I think there's a lot of factors, but I think the phone is a big part of that. And then just, not wanting to play, not wanting to be with other kids. We naturally, when we're little, we try, kids will go up with other kids on the playground and just play. You don't have to teach them how to play. But I think just that lack of contact, when that starts happening, I think that's a sign that, it goes beyond just kind of being down for a day. They notice this pattern over a period of time. I think, encouraging those parents to get their child into therapy like you've talked about.
I think something to keep in mind is the individuals that spend the most time with your kids are going to be your educators, your teachers, parents, family members. And so a lot of times those individuals start seeing changes in kids, and they will try to reach out to parents. Parents can also reach out to educators. And what I'm trying to say is, when we get to a point where school staff is reaching out to parents like, hey, we're starting to see this in your child, I just really want parents to have an open mind that we're on the same team. It's not we're trying to get your kid in trouble. It's not my role. I'm a school resource officer. I am a resource to the parents, to the students. I'm there for their protection, for their safety, and for their well-being. And yes, we do address criminal stuff that occurs around and in the school. But overall, we're not here to punish kids. We're not here to get kids in trouble. We're here to help the kids. And if there's some red flags that are happening, we are the ones that are trained to see these and to bring them into light and to try to get these kids the help and point them in the right direction. I always tell kids, even when they're getting in trouble or something's going on, like it's okay to make mistakes. Let's make mistakes in safe environments. Let's learn from these and let's move forward. And so just what I would pass on is that just keep in mind we're all on the same team. And when we do bring these concerns, we start seeing these red flags, that we work together to try to help out these kids and kind of help them and bring them in. And I've had great relationships with parents where they reach out to us like, hey, I'm starting to see this in my kid. Can you sit down with my kid? I'm concerned about their social media stuff, and they're always on it. They're being weird about it. And I'll sit down and talk to kids. And a lot of times I end up asking the kids questions that our parents are kind of scared to ask them. And the kids will tell you, I was a deployment officer for over 5 years, and during that time I did a lot of drug investigations, worked a lot of drug houses, and I talked to a lot of people, and you don't know if you don't ask. And when you start asking these questions, you start doing these investigations, people will tell you, and it's because nobody's ever asked them before. And when you ask them like how they got to where they're at, it's like they lost control, nobody knows, and all they're trying to do is trying to get back to that neutral. They don't want to be intoxicated, but they don't want to feel awful and withdrawals. And they don't know how to get help. They don't know what resources are available to them, and we can help with that. And so,
all right, next question. And we've touched upon some of this already, but I think it's important to just reiterate. How can I effectively check my child for possessing and/or using such substances without going too far, i.e. checking their pockets every day? What are the things as a parent I can do to kind of, if I'm seeing these red flags that Officer Morano, you were just speaking of, what are the things I can do?
I think the most important thing is we have to start talking about this with kids when they're young. And when you set the expectations that these are the things we're going to watch for as a family, we are going to have the ability to check your pockets. We are going to check your phone. I go back to drug testing. There is it's a fail-safe way to figure out what's going on with your kids. And if they are clean and they don't have any drugs in their system, what a great time to celebrate. Now we can keep it this way. So now you've started on a clean track, and you can continue to check. But I think it is vital that we check their rooms. I will take and steal and say a lot that kids can't own property in Texas. So that means anything in their bedroom is free reign for you. And I think if you do it in a way that it is not an attack in the beginning, this is just a part of the normal course of business. When you become an adult, many places give you a drug test. So we're prepping you for life, and this is what it's going to look like in our family. I think it has to be something that's consistent and enforced, and that there are consequences.
I will add to that where a lot of times we wait until it's too late. You know, things get out of control. Parents reach out to us where something's already happening. There's already some kind of dependency on stuff. And again, like, we're all on the same team. We're all trying to help out the kiddos. I don't think that there's an extreme. I think that, like she mentioned, if we start early, we can prevent a lot of this stuff from escalating and getting out of control. I'll give an example where I responded to a house and parents knew that their kid was essentially a drug dealer, and they were really wanted to kind of like, hey, we want to search, we want to do stuff. The kid was 14 years old, and he had a safe in his room, and I was like, why does he have a safe? Like, how does this kid have a safe, and why does he have a safe? And the parents were like, well, he asked us for a safe, so we bought him a safe. And I'm not talking about a little safe. This thing was impressive. And so I was like, well, that's a problem. Like, and there's something you need to realize is, like, that is your safe. And parents are like, what do you mean? Like, they don't own property. Like, as far as I'm concerned, they can sleep on the mattress on the floor as long as you're providing them food. None of their items, property items, actually belong to them. And so, don't let your kids take control. Like, you are the parent, all right? Limit, if you're concerned about social media or them being on these apps, take them away. Set parental controls on devices. I don't understand why all my sixth graders in middle school have Snapchat. I was like, that's a mistake. Like, that's not okay. I'm seeing nowadays trends where middle schools are on dating apps. And it's ridiculous. Like, why is this a thing? Yeah.
I think one of the things that's important too is we work a lot with Child Protective Services, and one of the things that nobody wants to talk about is if you have a 14-year-old and you suspect that they're using, or you think that they're using, or you've caught them using, and you have small children in your home, you have the potential to lose your smaller children to the system if you don't take care of the one who is using. Drugs like cocaine, fentanyl, methamphetamine, they're passed transdermally. And so if you've got a kid that's coming home and doing cocaine and they're helping change the diaper of your baby, they can pass cocaine to the baby. And so I always tell people, parents usually need a pretty definitive reason why they're going to do the things they do. And one of them can be, I need to figure out what's going on with you because I cannot afford to lose my other children.
Okay. Next question is, how as a parent can we support our kids, and when should we ask for the help from an expert? Where is that line where, okay, I need to maybe ask for resources, engage in someone who's professionally trained in helping my child rather than just doing it as a parent?
So on the police side, we have a department at our police. It's the community services, where they have programs for the public where they can go and ask questions for this kind of stuff. In the schools, we have our school resource officers as a SRO in every single middle school and high school, and we have some that are spread out through the elementaries as well. I visit elementaries. There's a plethora of resources. One of the QR codes that I put up there has a link to the DEA's website, where it's a great resource. There's resources for parents and kids. And that's straight from federal government, what they're seeing. And there's programs where parents have banded together where, I mean, they've lost their children and they don't want to see anybody else go through what they're going through. And I always tell parents that we are available to you guys. I will sit down with your child and with you, and we will. I don't want you guys to be the next victim. Like, I don't mind. I will, if it saves a life, I will do it. I don't care. That's why I'm here today. I want to be here today because I want to be available to everybody. And so, and that's how all of your school resource officers feel. There's only one chair, and I won the arm wrestling competition for it. So, yeah.
I think the other thing that's important is, like it or not, substance abuse is a very lucrative business. So if you want to send somebody to, I've had families call and say, we sent my kid to a inpatient treatment because they were smoking marijuana, and they charged us $65,000. And then they come to us after, and our LPC said, here's the deal, your child was self-medicating for anxiety, and they really need a psychological, and they're out $65,000. So I think it's really important to find someone who's willing to pick up the phone and call Grace to Change. We answer the phone all the time. We meet with people because we want to be a stopgap. We don't want, we don't want to overtreat. I'm a big fan of not over-treating. If you've got a child that's smoking marijuana and done it a couple of times, I'm not going to put them in my group with my fentanyl users or my high-volume marijuana users. I'm going to figure out an individual setting that works for them. And unfortunately, insurance and funding play a role. But I think it's never too early to ask for help. It's just, don't go to the extreme and dump them in inpatient.
I always have the trouble with me. I think, obviously another great resource is your guidance counselor. On each campus, we have counselors there, and in addition to them, we have licensed professional counselors who meet with students. So that's a good place to start. I think there's sometimes some hesitancy because you're not sure what's going to happen. And you can go in there in a confidential conversation and talk with a counselor and just get information about where you go from here. When you walk out the door, they can give you resources, and so they and they're there. It's free. Another good thing, and it can be expensive to get help. And so don't hesitate to reach out to them.
Sorry, I just remembered something. So before the beginning of each school year, I know that we've had it at Bright Academy and at Frisco High. We have these like multicultural events or community events where we all kind of get together. And I like to go because I speak Spanish, so I kind of meet with the Spanish-speaking community. It can help them. That's when they get help registering. And there's different booths throughout this whole thing. And we have a police booth there. And we provide a lot of information in English and in Spanish. And we have a lot of officers there that are, what we're trying to do is build a relationship with the community. We don't want them to be scared. Like, we are there to help. And it's great because the community sees that. We provide resources. And we're sitting there all day just answering questions left and right. And I've even gone to help parents register, to help them register their kids. And they're like, oh my gosh, like that's not what you're supposed to be doing. But it doesn't matter. Like, we're here to help in any aspect of it. And so just spending time in the community, helping out with those kind of things, and just making ourselves available. So if there's like a community event, we try to be a part of it. Like, I think winter's coming, so we're gonna have posadas in the neighborhood, so we can do that as well. And I get asked all kinds of questions at all these events, and it's great because it's an opportunity, and we're all approachable, and we're ready to just kind of be there for everybody.
All right, we have time for just a couple more. One question was, where did it go? What does the district have in place as far as opioid education and prevention, along with Narcan education?
I think I'll hand this to Mr. Solari. Yeah, we started working last spring on this topic because
Hey, James, I think you want to use the other microphone. That one's not working.
Hello? Okay.
Yeah.
Woo. All right. Yeah, we started working last spring in our SHAC committee here in Frisco as far as things that we could do in addition to what we typically do during Red Ribbon Week, which is always, it's around the third month, the third week in October. And we always have a lesson that day, but we wanted to do something in addition to that. And so we put together some writing prompts for students for, what were the ages?
6th through 8th grade.
6th through 8th grade. Well, also high school.
I mean, 6th through 12th grade, excuse me.
6th through 12th grade. And you want to tell them about it, Mr. Solari?
Sure. Just real quick, it was just sort of an extension of the opioid education that we do in the school districts. So they were asked to do writing prompts on what are healthy alternatives to drug use, how can I, some of the prompts dealt a little bit with peer pressure, and then also kind of writing a letter to their future self of how to avoid these things and how to make good decisions. So the other part of the question asked about Narcan education, and this was something that came out of feedback we got from our student ambassadors. So now all the posters in the high school have, and it actually came from the same website that Officer Morano and the One Pill That Can Kill DEA, and the Texas website for opioid prevention. And it shows on there the different ways to give Narcan and how to overturn opioid poisoning. So,
yeah, and instead of just doing this within our advisory lessons, the English department has teamed up with us and are actually doing it through English classes. And it's kind of a new approach, first time we've ever done anything like that.
There's also something called Tucker's Law that is put in place now in Texas that says every student between the ages of 6th and 12th grade has to have some opiate education, and there is 2 curriculums right now that are being developed, one for Texas Against Fentanyl and then Texas A&M, and so hopefully they will have some mandated curriculum that we can use across the state to give everybody the equal and the same education.
Yep.
Yeah.
So I know for us in schools as an SRO, we have what's called Party Time, and it's a state mandated program where we go. It's a big advisory. It's a long lesson of multiple days where we essentially talk about alcohol abuse and drug abuse, and we go with, it's in the middle school age, and we work with these kids. It's a state mandated program, and the thing about it right now is it's being revamped and updated, and it's being modernized to try to make it more appealing to today's generation. It is a program that's been around for a while. The state's working on making it just, I guess, more interesting, or just make it so that the kids want to definitely participate more in it.
Excellent. All right, last question. It says, I know that social media is playing a vital role on kids' mental health. How can we as a parent control it? What are some of the things that we can do? Because it's becoming a big challenge for parents.
I would say replace it with any kind of protective factor that you can come up with. You can't just tell them don't. You have to replace it with something, and you have to model good behavior, like I mentioned before. Try to stay off your own devices during dinner time and things like that. The more protective factors that a young person has, the more activities, the less likely they're going to be glued to that. There are studies that say that this is become an addictive. It's an addictive activity, and that it rewires the brain. And so to catch it first versus to try to stop it, I think is huge. Do everything you can with your kids to have pro-social activities that don't involve the electronics. It's anxiety producing for both boys and girls. It's an in for people who push pornography. It's an in for traffickers, the quote-unquote dating that we're seeing. The fact that we're talking about mandatory fentanyl training for 6th graders, is that not 12 years old? And so how is this information getting to them? You're not offering them fentanyl. It's getting through to them through this deal right here. So
I will say, definitely social media helps carry with unfortunately with bullying. Like, unfortunately, we're not just seeing bullying at schools when these kids are being targeted, and it follows them home. And like with social media, it's another avenue where these kids that are disturbing other kids can follow them and chase them all the way home, and the kids never get a break from it. And then we start seeing higher cases of kids wanting to self-harm because they can't escape, they can't get away, and unfortunately, like they don't want to talk about it. And so that's why it's important to know what's going on with your kids, know what your kids are doing on their devices, because we don't want to find out when it's too late. And so limiting it or them not even having access would be fantastic. Like, I don't think that they need it. I don't know why they need it. I can't think of a reason that they would need it at all. And so, yeah. And then also group chats too. It's not just social media. What we're seeing, these kids are getting in trouble because they make these giant group chats and then they start chatting about dumb stuff, and they get little dopamine dumps because they're like, ha ha ha, everybody laughed at my thing, and they're participating in it, and then it takes one person to say something funny, and somebody tries to one-up each other, and next thing you know, they're saying things like school threats, and then next thing you know, yeah, or they're sending horrible messages to each other, and it's just bad. Like, I tell kids, why are you part of this group chat? Get out of it. Stop.
So many of my assaults between the kids at school start because that kid is actually being bullied and cannot take it anymore. And there is no legal defense in Texas for verbal provocation. So somebody can say the worst thing under the sun to your child, the worst thing. It could be faith-based, it could be race-based, it could be sexual innuendo. You cannot ever return that with violence. And so many kids I see in detention, that's what they've done. It's like the classic football game, right? All the jawing goes on and they only catch the second guy. But to your point, that kids cannot get away from the bullying. And also the threat's real because they follow them home figuratively on the device, but literally we've had kids Uber to other kids' houses to commit crimes, to beat them up. So your kids cannot get away from these bullies. They're not safe from them. So.
And one last thing on the about the phones. I've had luck. I have a private practice when I'm not up here, and we've had a lot of luck with having contracts. And you can just Google cell phone use for teenagers contracts, and it just states what you'll do as far as your responsibilities as a parent to your child as far as having their phone, and how you'll respond if they, maybe they have something show up on their phone that is not a good thing for whatever reason, that they can bring it to you and you won't take their phone away because you want to keep that line of communication open. And so that's a very good way to work it from the beginning, because you set the tone. Obviously, it's the parent's phone. It's not the teen's phone, and so you have a right to do whatever you want to with it. But I think when you make these rules, if you make them fair and you're consistent and you do what you say you'll do, they're more likely to do what they say that they're going to do.
All right. Thank you very much, panel. We appreciate your time and your expertise. There's been a lot of great information tonight, and that's going to conclude our meeting. But thank you.